for
Oh,
starting late, but thank you for your time.
oh yeah, sorry. No worries. I did not realize we weren't being recorded. Sorry. Okay. And you're sharing the slides after this, right? Anyway, hopefully they'll be sharing the slides. If you have any questions or, if anybody
Yes,
viewing this.
we will be
Okay.
making your slides available too. Yeah, absolutely.
So anybody viewing this later can certainly take a look at the slides, and then, feel free to email us if you have any questions about any of the unrecorded parts. Okay. And then for the moderation analysis, again, we use that overall satisfaction number. That's the other predictor variable we brought in. Let me get back here. All right. And then there's a group of variables that we brought in as potential covariates. So you may be familiar with kind of the common use phrase of we have to control for XYZ. So these are things that could potentially be altering or related to that job satisfaction outcome that we're really interested in learning more about. And so we want to make sure that we've accounted for them in our analysis so that if they are having an impact, that impact has been kind of controlled for, evened out, essentially. So we're really seeing what relationships are there, and we're not seeing false relationships that aren't there, that are based on one of these other variables. So those factors were age, payment received. So a peer worker might be paid, they might receive a stipend, or they might be unpaid volunteers. So that status was something we took into account. Whether they received formal peer worker training, how long they had been employed as a peer worker. So that's kind of that tenure in the field variable. And then the hours that they work per week, that kind of goes back to, remember that second study that we talked about where there was a disparity in workload between peer workers of different races. And then also whether the person identified as a consumer of mental health services. So somebody who is in mental health recovery or who uses mental health services. And then the analyses that we did, I used a software called Castedo. I did descriptive statistics. So that's things like demographics, average scores on all of those variables we just talked about. So we get a picture of like who is in our sample essentially. And then for the first question, I did something called ordinary least squares regression. We'll talk about that more in just a second. And then the moderation analysis using that same method, but basically adding on another layer of analysis as well. And the robust standard errors just means that the nature of my data meant that I had to kind of use a larger confidence interval. And it's not the most efficient model, but it's still good enough. All right. So just a quick note on regression. I think sometimes in some other contexts, people might talk about regression in a way that they use it for predicting things. Here, we're not trying to predict anything. We're just looking at potential associations. And as a great example, you kind of expect for an adult human's foot size and their height to be at least somewhat related, right? And in this chart, this is kind of a standard example. You can see how it looks like, yeah, okay, as people are getting taller, their foot size is increasing, all right. Essentially, we're asking the computer to draw a line through those data that explains that relationship. And if it can fit a line appropriately to those data, and that line is unlikely to be due to just random chance, then that line is statistically significant and we have a statistically significant association. Some other variables, some other factors could tell us if we can use that for prediction, but we're not interested in doing that here. We just want to know if there's maybe a relationship. And then maybe what I would want to do is have some follow-up studies, really trying to understand what the relationship between human height and foot size actually is, right? But let's look at something where there isn't a relationship. Adult human height and the length of the hair on their head, that's probably not actually related. This is just made up example data, but it could look something like this, right? I could be 10 feet tall and have no hair, or I could be, a baby and have a ton of hair. So we don't expect that to actually be related. And the computer, in trying to fit a line through that, would probably say that we can't get any statistically significant ones. That means that these two phenomena are probably not related, and we'd probably stop trying to investigate whether those two things are related after that point. So I'm going to talk about the highlights of my results on the subsequent slides here, but I did want to invite you, if you want to look at the full results tables, you can follow this bit.ly link to do so. It's just yesterday's date and my initials all crammed together as one. There's no underscores or anything like that, but I believe it is case sensitive, so it's all capital letters. So 11822 SJCM. And let's go through the results here. So these are just the descriptive statistics. Our sample was mostly, largely Hispanic. We had a good spread of different races and ethnicities, about half female, good spread of ages, but there were very few young adults. There was only about 2% young adults. Most people were paid for their work. Most had received formal training. And then a solid chunk, 37%, identified as being consumers of mental health services. And the average length of time of being a peer worker was about 6 years. And most were employed just a little bit below full-time on average. On average, they had just one coworker or colleague across their support networks, but all of the participants tended to have good job satisfaction overall. So we had higher scores on those positive scales and lower scores on the negative one. So let's look at those research questions that we introduced earlier. What we saw was that coworker and colleague density was actually consistently and positively related to that peer supportive organizational climate measure. So again, that's the one that, it's not exactly job satisfaction, but it is related. We'll talk more about that in a second. We also saw in just one of the analyses that the overall job satisfaction, so that single measure, that was positively associated with relative density. So not those other measures of coworkers and colleagues in your network, just that one. And then in just one of the analyses. We didn't find any evidence for the moderation. So that moderation being where the slope of that line changed, we didn't see any evidence of that. So no findings on that part. And I thought I heard an unmute. Do we need to pause for a question real quick? Okay. So what do we think this means? With peer supportive organizational climate, again, that was the one that kept coming across as being really consistently related to having more coworkers and colleagues in your support network, no matter how we measured it across all the different types of analyses that we did. Now, it's not exactly job satisfaction, but it is related to job satisfaction. I actually did like a quick little analysis, and yeah, those two things are definitely related, at least in this sample. But importantly, which one comes first? Aren't we just kind of measuring the same thing? If you have more coworkers and colleagues in your support network, therefore maybe you're already part of a really supportive organizational climate in order to have that, right? So that being kind of intertangled with this, the idea of having coworkers and colleagues in your support network already, that makes it a little bit difficult to parse. But it is related to job satisfaction. So it might be something kind of worth studying further, looking at a different way, maybe asking different kinds of questions about it. And so that's something that we'll talk about more in our discussion section with all of you. Now, for the second result, that single question, how satisfied are you with your job? That was related to relative density. So relative density, remember, that's the one that takes into account more of the person's overall network. So if I only have 9 people in my network, that's my denominator, it's accounted for that. So that single question, it only came up as associated in one of our analyses. So it's something that is worth exploring further. But it's not an effect that we're picking up in different versions of our analysis, essentially. So we want to explore this further, but I think we need more information about how we should go about doing that. So some potential future directions, things that we're thinking about. We want to explore different factors that are related to job satisfaction and retention for peer workers. We want to target those factors in policy level, organization level, interpersonal and individual level interventions. So kind of maybe it's something that needs to be targeted through policy level changes, changing the organizational climate, all the way down to the individual level. But we really want to get input from all of you as to what would be good future directions for this kind of work to go in, and where we might most usefully put our efforts. So what I want to do now, I have a few questions. I've got 2 different slides of questions lined up. Do feel free to address other questions that you might have for us first. I am going to pull up the video screens here so I can see all of your faces. And yeah, so I'm going to pose this question first, and then please jump in if you have a question that needs to be addressed before we get into this discussion. So first of all, does workplace social support matter to your own job satisfaction, to you individually? And feel free to unmute.
Hi, can you hear me?
Yeah.
Hi, this is Vanessa, and my name's Vanessa Ramos. My pronouns are she and her and hers. And for me, workplace social support totally matters, especially when I'm working in a role where I'm disclosing my quote unquote invisible disability. I think it really, previously I worked in a role where I worked in a leadership role, just as a peer, and when I had a peer manager that was well versed and was a peer through their own lived experience, it was amazing to see how I was able to gain comfort that allowed me to progress. And when I served under a peer manager that didn't have that lived experience, and that, serves more in a role where it's like a bureaucratic process, it created tension that promoted stress, which triggered many of my own vulnerabilities, and it literally I left. So it's like I've left a high-paying job because of the lack of that support, that I believe is, like Pat Deegan says, our personal medicine. And now being out of that setting, and starting my own work through the Healing Heart Project, I feel really committed to honoring those workplace social supports because of my own lived experience, and having, someone like, Tina Wooten, who I've always loved, and then having, someone else.
Awesome. Thank you so much for sharing that experience. I'm sure I saw a lot of head nods, so I think a lot of people can identify. I want to address a question that I just saw come up in the chat. And by the way, I do have the chat box open now and I can see everything in there. So if you feel more comfortable asking something or saying something in the chat, go for it. But I saw a question here. This is from Jan. Am I pronouncing that correctly? This is about, does the study suggest that a smaller organization with less employees would lead to less job satisfaction? Or is it about the quality of the work relationships in place? So this is a great question. So I think this is why that, remember we measured coworker and colleague density in your support network 3 different ways. That second way that we measured it, the relative density, that one would account for a workplace being smaller. Like maybe you just have less access to, coworker and colleague support because you work in an organization with 5 people, right? So you could have a maximum of 5 coworkers in it. Maybe you could have some colleagues. Maybe you're out in an area where you don't really have any colleagues at all. It would be able to take that into account. We really, this is all kind of a little bit exploratory too. So we kind of wanted to slice it and dice it a few different ways to just kind of see what does tell us the most information, what gives us the most nuance. And I think that second one, the relative density, is the winner there. And for exactly this issue that you raise as well, because it would give us, it would allow us to kind of account for or control for the size of that organization. So our study isn't really telling us anything about the size of the organization's impact, like that doesn't necessarily have an impact, but the way that we measure it, one of the ways that we measure it is actually accounting for that potential issue. The best way to account for it would actually be if we asked them, if we asked the participants, hey, how many employees are at your organization, or how many other peer workers are at your organization, or however we wanted to ask about it. We would have to actually ask that question and then include that in the analysis in order to truly control for it. But yeah, so this analysis is somewhat to some extent controlling for that, but not 100%. And then the quality of the work in the quality of those work relationships. That's what we were trying to get at with the moderation analysis, with that layering on top, that the quality of my networks. That one did not give us any, we had null findings. So that means we didn't see any relationship there, but that doesn't mean there isn't one in general. It just means we didn't see it in this sample, right? And the participants that we had. Okay.
Sarah, there's a couple people with hands raised.
Great. Yeah, sure. Let's do that. So I think does it just kind of put them in order of hand raising?
Yes, I believe Sarah's next.
Perfect. Okay, great. Yes, if you know the system better, so please help. Great. Yeah, go ahead, Sarah.
Thanks. Thanks, first of all, so much for the presentation and the research. It's terrific. I wonder, so I work at a fairly small peer-run organization, and I would love to know if you're able to point us in the direction of useful survey questions for measuring the level of support that people are feeling in their jobs.
Yeah, that's a great question. So, Dr. Brown, I don't know if you want to address that and talk about some of the measures that y'all used and.
Yeah, I think, it's an interesting question. One that I think we're still struggling with. Sierra and I, we talked about the measure that we're using, which is really like a count of the people in their network that you trust that for various social support related issues. But then another approach that we didn't take that we could have taken is just perceived social support, in this sense of being able to, rely on our colleagues in a general sense rather than naming specific people. And yeah, they both have their merits and weaknesses. And Sierra, I don't know if you want to expand on that at all, but that's.
Yeah, sure. Yeah, so, there's the social network approaches. I have some really great applications, but maybe this isn't the best one. We just don't really know yet. And that's kind of one of the larger things that we're trying to figure out that would apply to kind of more settings than just this one as well. But, there are some examples. There's actually some great repositories of measures that I'm blanking on the name of right now. But a great example of just a couple questions you could ask comes from the standard data collection tool that SAMHSA uses in SPARS, the CSAT version of SPARS. So you ask first, did you have any supportive interactions with people who support your recovery? Then you follow that up with, who do you tend to get support from for your recovery. And it has some potential response options, family members, clergy, friends, et cetera. And then you follow that up with how satisfied are you overall with your support network? That's a really standard one to use, just because, SAMHSA is big and they're using it. But there's a lot of different ways that you can go about it. And, social networks approaches are just one way of doing that. And they're an interesting way, but maybe they're not the most efficient way. We're not 100% sure yet.
Thanks so much.
Absolutely. I had a question in the chat about ages of participants. If you check out the link, if you scroll back up I can copy and paste it in here again. But if you go to that detailed tables link, that will have the detailed breakout of age categories. But we did not run a separate analysis on whether or not that impacted job satisfaction, but we did include it in the analysis. So if it did, that was controlled for. And then I don't see any raised hands currently. Is that correct?
No raised hands. I think Cynthia Chavez just put in a question in the chat.
Yes, I see it. So this question is, was there any data that showed financial employer support through tuition reimbursement helped with job satisfaction or retention? That was not something that was asked about in this. However, I think that Jones study did ask about whether peer workers, whether that was like a potential barrier to their, it was something like if it was something that they desired or something like that. So I think they asked about it. They didn't necessarily ask about it in the context of retention exactly, but they did ask about that issue. So that might be something that paper would be a great resource to look up more again. The SAMHSA tool, it's the GIPRA technically, but it's that Center for Substance Abuse Treatment data collection tool that they use. Let me just type all the acronyms. It's a big acronym soup over in the behavioral health world, right? So I'm going to type it into the chat box. And it's a very long tool. So this is just like a small set of questions within this larger tool that they use. But that might be a place to start. There's quite a few other tools out there though. Okay. So I'm going to turn it back to questions for you. What makes a supportive workplace to you? What do you think? What are the factors that make it supportive?
I'd like to answer that. I'm working in a recovery learning center. A couple of my peers or coworkers are in this too, and my boss too. We work I work in a place as a peer with my diagnosis, my mental health challenges, also with other peers too that could have severe or low symptoms. And so sometimes when it gets tough with somebody, difficult to respond to, especially the masking, having their mask on, dealing with these guidelines that we have to make sure we're safe and everyone has, respect for each other. It is so critical for me in this job of 3 years working in a recovery learning center at the Mental Wellness Center to have support. And I believe I've got that with the management. He's in this group too, is to feel heard, to feel like we can, like I've learned with Jan, with checking in with each other. So kind of want to add with what his question was with quality. And the quality part is for me as a peer specialist is to have that with the management, also with my coworkers, and to feel heard, feel like we can have check-ins. I appreciate those now with Jan's management, and addressing the situation, because I found if I address it immediately, sometimes it's not the right time. And so it can also blow up. So I just wanted to share how the support to feel validated too. It's nice to feel like I'm doing a great job in my work or I'm helping somebody. And when a situation happens, I have, someone's there coming by, a coworker or peer is coming to help and check out that situation. So I feel supported with that, watching that happen in action. And so I appreciate that on the level of, at the time, real time, a situation happened, I had the manager or a peer specialist coming to help me out in that situation. So I feel supported. And then also having check-ins with the staff, and maybe I don't have the right or know the question or have the answer for the person. So let me check in with my team. And so I appreciate being able to have that a part of the dialogue or part of what I say in conversation before I start into something or help in some way. So, or support somebody in some way. So thank you for letting me share.
Thank you so much. That was really great. And I see a hand raised. Erica.
Hi, and you may have covered this. I had to step away to use the restroom. But did you say that there was differentiation called out in the study of peers working for peer-run organizations versus peers working in organizations that aren't peer-run but have a mix of staff and are on the staffing there? Was there a difference that you
I did
found
not.
if you did? Oh, okay.
I
Because
did
that
not.
would be really interesting to me
Yeah.
to see the level of support that a peer receives in a peer-run organization versus those larger organizations. Well, peer-run organizations can be large too, but but the more clinically based or public mental health kind of organizations. And then I just wanted to share too that I think something that we have found in our clubhouse is one, by default, people coming in to work for us are identified as peers. So by default, there's already a connection with other workers in the workplace. So I think that allows for that a little bit for that social support to develop a little bit more sometimes. And then, I think it's important for employers to provide like wellness-based opportunities for staff to participate in, both in the workplace, but also, external to the workplace for the social support that are built.
Yeah, great. Thank you so much, Erica.
Sure.
Okay. So I know we don't have too much time left, so I'm just going to ask this question. I'll ask that you respond in the chat box. Does support from colleagues at work who do similar work at other organizations, does that matter to you? Go ahead and put it in the chat box, and then I'm going to tick on to the next page.
Oh, and
Yeah.
Joanne Westpoint had her hand raised.
Oh, okay, great. I did not see that. Please go ahead. Unless we already addressed it.
Oh, hi, yes. I just wanted to kind of piggyback on what Erica says, because I work for the County of Los Angeles and I have no peer support. I'm on an interdisciplinary team. There are many community workers, but I'm the only one, I'm the only peer. And this year has been really, really hard. It's been like a drag out, knockout fight because now the eyes are opening about what peer services does and what it is going to do for the County of Los Angeles. But this year has been really rough and there's very little support. I have to really go outside or catch a meeting where I can find other peers.
Thank you. Thank you for that. Yeah, that's very important. Okay, I am going to ask a couple of questions that are a little bit more like action oriented. So think about, kind of what would be your ideal solution or ideal scenario. What can employers of peer workers do to increase job satisfaction? What would make you more satisfied in your work? And then also feel free to answer. They're kind of related. What can they do to increase peer worker retention? What would make you want to stay in the role long term?
I think authenticity, it's especially because with peer, like now there's so much money on the table. We're finding that people who don't have lived experience are identifying as peers So like I can
Mhm.
say I'm a peer manager, but that doesn't really mean that I have lived experience, right? Or you can't really dig in because of HIPAA. So I think
Mhm.
authenticity, you know, just like transparency, authenticity, and openness, you know, like let me know, you know, like how is this affecting you, or how can we work together, or you know, we're creating this program, like what's your input, you know, that inclusivity.
Can you, do you mind if I ask a follow-up question? And I'm sorry, for
It's
whatever
like
reason,
they
I
have a
can't.
mysterious hold on her.
I'm sorry? Oh, I'm sorry. I wanted to ask a follow-up question to the person who just spoke, but unfortunately my computer did not bring you to the forefront, so I'm not sure who it was. Um, so you mentioned this being a particular issue for the peer manager role. Is it is the phenomenon of somebody, you know, of maybe not having that authentic peer experience, that lived experience? Is that something that you see more in the manager role? Is that something kind of you all see across the board? I'd just love to know a little bit more about that.
Sure. So I served in the county of Santa Barbara, and I originally served under a peer manager who had lived experience, meaning that they had navigated the public mental health system. They had received
For the speaker to
services at
work on
some
it now.
point. And so when issues or when programs would come up, she naturally would create that stakeholder feedback amongst us, right? We would all work together. And now, you know, because of the amount of money behind these peer titles, you know, I was in a role where the peer manager did not provide peer support. And, you know, where like there was no space for that, you know, and it was so mind-boggling because I thought it was assumed that a peer manager would provide peer support, but the way that certain counties are moving, kind of to like Joanne's point earlier, is that, you know, we're here to build systems. We're not here to provide peer support, which really dilutes, right, what that role is, because there is, you know, kind of like what Elizabeth is saying, like this stay in your lane mentality. Like, you know, you're a worker, you do your job, and that's it. If you need help, call the employee assistance program, or, you know, that's an issue for a different place, which really starts to break down why peer support has been so successful up to now.
Gotcha. Okay. So kind of the authenticity issue being diluted by just to make sure I'm getting it right, kind of being diluted by the influx of interest in funding, and yeah. Okay. I would love to hear any other thoughts or comments about what can employers of peer workers do to increase job satisfaction or job retention. I know we only have just a couple
Yeah, I
minutes
was gonna
left.
just hop in real quick. Just a reminder, we have 1 more minute, but this room will stay open until all day, but also the next talk starts at 10:15. So if you want to keep discussing after, that's fine.
Great.
Yeah, I just like to say, I think peer support is being a lot of things, a community health worker, a mental health advocate, until what we really stand for is becoming diluted. That's what I'm seeing. Because, you know, at the end of the day, those competencies, it means a lot to me, but it doesn't really mean a lot to the other people that just don't know anything about it, who have not been exposed to peer training.
Thank
Yes.
you. Thank you. Thank you.
I want to add to the communication, like speaking up. I've found that has been my strongest tool, even if it may seem a little uncomfortable. So if I feel that it's not working out for me, or I'm having a tough time right now, and I'm trying to stay on with this and the change, and there's so many factors that I have in my life. Just got a lot of things I want to do with go here and go there, to be supportive to my community and peers. That it's it's in my best interest, and I've known this, in my age now, is to speak up. And I feel that it has been the response from the management of where I work, to do their best to do it in real time. And so next thing you know, having a meeting, checking in, or sharing about my feelings, showing examples of where I didn't feel like I was being heard, or this situation just threw me off. And then just learning new personalities, all different characters and personalities. And the team effort is different for me now. So from pre-COVID to during these times. So it's been change, and speaking up and appreciating myself for doing so that I can get those issues out in the front, and then find solutions for it. And it seems like it works out where even the boss finds something that is a solution. So not just my own thoughts and perspectives upon finding a solution, but the other person, and it's actually the management that does, or it just works itself out. And when I'm heard, they know the situation, and then they can work with me on helping find a solution. So thank you.
Thanks so much. I really appreciate that. So I also really appreciate all of you for attending this talk and for your great questions. If you have any additional questions or feedback, feel free to email us. And I apologize, our email addresses are so long. If you want to look at any of the references we used throughout this presentation or check out those tables again, it's at that link, yesterday's date, my initials. All right. And it's also in the chat box. Okay. Thanks so much, everybody.